I would add, this is actually exactly how I would want this brain to look like if you're in a building that's on fire. That's how we want the brain to look.
Yeah.
But Keela's right. When we're doing this assessment, we make a really relaxed environment. And if we're seeing the brain acting like that during a relaxed state, then we've got an issue.
Basically, we look at a whole head of a person and we record their brain waves at the baseline when they first come to us. And we say, what is going on in this brain? Somebody's saying they're having anxiety or experiencing nervousness or fear or trauma response, etc. But what does this actually look like more objectively? So we take a look inside. The first one is the excess high beta. So high beta brainwave is 23 to 38 hertz. And we have three circles within each of these images because we always look at 1 minute with eyes closed, 1 minute with eyes open, and 1 minute doing a task of some kind. So it's like some silent reading. And we see here that anytime we're getting beyond about the blue colors, when we start to get green, yellow, orange, and red, if we were to see red here, that's just getting higher, 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 higher on the spectrum of how much of that particular brainwave is being produced at that time of measurement. And so here we can see excess high beta. It's like getting higher in the region of the brain around here because it's bird's eye view of the brain. And it's getting higher at eyes closed, that first circle, but then it really heightens at the second and third circle, which is the eyes open and task. So every time a person gets into any kind of an alerted state beyond just sitting with eyes closed, relaxing, we have a ton of high beta. And high beta is just at that amount is just not very efficient way of our brains operating. It's kind of like the threat signals coming online and going like, uh-oh, this is not good. There's a threat here. Yet the person is just kind of sitting in the chair in a nice, cozy office with a lovely staff member, you know? So theoretically, there should not be really any threat to this, but this one is showing that the brain is interpreting this as threat. So that would be one way that anxiety can show up.